So this week I'm going to bring up the subject of embracing the pain, embracing in particular the fear of pain. And this was a subject matter that came up at the recent Congress, a World Congress on Pain in Boston in the US, where I was attending with thousands of delegates. And one of the theories of chronic pain which intrigued me was that we have a fear of pain, and that brings a conflict in our minds and then creates more fear. And what actually happens is that we are prevented from moving or going about our regular activities in the day because of the fear of damaging our tissues. In fact, just one patient today, I was talking on this very subject, and the words that came out of his mouth was, I'm scared to damage my tissues, because it feels like you're damaging your tissues when you've got pain. So you've got back pain or neck pain. And that comes from an age-old survival technique or survival mechanism or reflex, that if you get hurt, then you don't want to injure more of your tissues, so you protect it. You maybe do less activities, with the concept that we're actually preventing further damage. But in the reality of chronic pain, it's not an acute problem. It's a chronic problem that's lasting for 3 months or more. And we now know from the science, from researchers in Chicago, that it's actually the limbic component of the brain. That's right in the heart of the brain, right behind your eyes and below, right in the heart of the brain, where we feel emotion. We can feel anger, we feel rage, we feel sadness, depression. So the emotions that we have are the same centers that we experience pain. So there's no need to be in fear of pain. In fact, embracing that fear is essential to moving on. I had a conversation with a colleague from Boston who was presenting a poster, and we ended up having an interview. It's on my iTunes show, and she was talking about how in their clinic down in Beverly Hills, that they spend the first visit with the patient, sitting with them and explaining this and getting them just to literally embrace the concept of their pain, because it's not going to run away, it's not going to go away. And if you embrace it without fear and without judgment, that is the first step to healing and moving on in this situation. The one author comes to mind is Joe Brass. He's a professor at UBC here in Vancouver. And I read a book of his several years ago, and it's called Healing the Child Within. And it's a marvelous description of what actually goes on in the human psyche with chronic pain and with other illnesses or other mental health illnesses. But essentially, when we are anxious or in fear of, say, living with pain, one thing that we can do is sit down and just put our arms around our body and give ourselves a big hug. And when we do that, imagine that within you, there's a little person, let's say a 3-year-old woman, 3-year-old girl, a 3-year-old boy, who's very scared. He's scared of damaging the tissues with chronic pain, scared of moving on in life. And it's absolutely essential that if you can sit down and just give yourself a big hug and imagine that you, the parent, or you, the adult, you're the mature one, can say to the little one, it's okay. You don't need to be scared anymore. I am here. I will protect you. And that's a rather profound experience that I've went through myself many years ago when I practiced this. And also I've been sharing this with patients for years now. And a very simple technique of embracing that little child of fear around pain. So I encourage you to maybe try that. The next time you're in a lot of pain and you don't know what you're doing and you don't know if you should move or should do that activity, just stop and take a moment to yourself to breathe, give yourself a hug and embrace that little person inside that is very scared. So hopefully that's helpful as a little tool. And I would like you to leave some comments, ask me a question. I'll get back to you either here on Facebook or on Instagram. Just one legal disclaimer here. I know if you do have chronic pain, it's important you follow up with your own physician. This is for educational purposes only. Or if you don't have a physician known to you, then you go to a local community, maybe a walk-in clinic, or where physicians are available. So hopefully that was helpful tonight. I hope you enjoyed it. So thanks for listening. Have a great evening or a great day, and I wish you the very best. Bye.